We've got Dr. Kevin Kavanagh with us. He's been a regular on this program for a long time. Good morning, Kevin.
Good morning, sir.
You are a retired ENT from Somerset. You're also founder of an organization called Health Watch USA. What is that?
Yes, it's a nonprofit patient advocacy and healthcare policy research organization, which we founded approximately 10 years ago. And we're very concerned about increasing the quality of our healthcare and trying to make it more affordable, decreasing the costs.
You made me aware of a LA Times op-ed piece that was published. You know when this was published?
It was published on Thursday.
Oh, so it's pretty new.
Yeah, brand new.
May I read it?
Sure can.
It says, collective ignorance and government timidity are public health threats. And this goes on to say, it's not very long. It says, I live in Kentucky, a state with the nation's largest hepatitis A outbreak, an emerging measles outbreak, and a governor who said he exposed his children to chickenpox rather than get them vaccinated. In the past year, 2 heads of infection control in Kentucky's Department of Health have left the position. The first one was asked to leave after he expressed the need for an urgent increase in infection control funding. I am a firm believer that we must learn from history or be doomed to repeat it. Unfortunately, the United States and many other nations appear not to have learned this lesson with regard to public health and are heading down a dangerous path. Do you agree with all that?
I certainly do. It's certainly my opinions, and I think that we need to look back at history when we look at the mistakes our politicians and leaders are making. It's really riddled with examples in previous epidemics of the same thing happening. In fact, one time with the bubonic plague, it was being considered to make it a felony if you release the data to the public. And this sort of thing is rampant in today's policymaking of trying to inhibit getting information out to the public. And so these are things that our organization is trying to correct and reverse.
Anti-vaxxers are quite a movement now, aren't they?
Well, they are, and I think a lot of this has to do with being scared. It has to do with false news on the internet, but many of these vaccines have been around for decades, and they've been transformative. So I really think that people need to sit down and try to remember or ask someone who is around, such as myself and you, when we had these epidemics and when vaccines came out, there were long lines to get them. The other thing I feel that people need to remember is that not all vaccines are the same. And certainly the time-tested measles, mumps, polio, chickenpox, these have been around for quite a long time, and I feel that people should go out and get vaccinated.
I live in a time, and you do too, that when we were kids, we got vaccinated for smallpox. They still vaccinate for that?
Well, smallpox right now, they've declared victory, and hopefully that disease will not have a reemergence. But right now, I do not believe that they are vaccinating. Now, I was vaccinated for smallpox. That was, of course, a huge scare back when I was little. And that is an extremely deadly viral disease. Not quite as bad as Ebola, but I'll tell you, it ranks right up there. It is very bad. And unfortunately, geneticists have outlined its DNA code. It's probably still lurking around in some laboratory someplace. And a reemergence is not completely impossible.
Wow. Hep A, tell me about Hep A.
Well, there's hepatitis A, hepatitis B, and hepatitis C. Hepatitis A is the most infectious form of hepatitis group of viruses.
Is that what Mother Judd had? I think it is, but I may be wrong.
I'm not sure. And there's been a lot of research that's gone into these viruses. There's been vaccines developed. They're quite effective. I had a first hepatitis A vaccine over a decade ago when I was a surgeon, and we also got vaccinated for hepatitis B. Hepatitis B is more transmitted by blood and fluid, and it's not quite as infectious, but it's a more dangerous type of an illness that you can get. And of course, there's hepatitis C, which can be very indolent. It's hard to get rid of, and that's associated with liver cirrhosis and also liver cancer. That being said, hepatitis A is still a very dangerous disease. In Kentucky so far, we've had over 4,600 cases. almost half of those have been hospitalized, and there's been 57 deaths. And when you think about vaccines, many people will say, well, we're worried about this, we're worried about that. I don't know of 57 deaths from vaccines in Kentucky, but we have 57 preventable deaths from hepatitis A. So certainly I would get vaccinated. In fact, I have been vaccinated for hepatitis A, and I received a booster recently.
That's a 6-month thing, isn't it?
It is a 6 month.
I need to get mine, too.
Yeah, it's a 6-month thing. You get an initial shot, and then 6 months later, there's another injection. If it's been a very long time, because immunity can wane, and some of the initial vaccines weren't as good as the ones that we have now, sometimes it's not a bad time to talk to your healthcare professional and see if you shouldn't get an additional vaccination. So I think that's very important. I also got a shingles vaccine, and I certainly don't want to get shingles. I had chicken pox when I was a child, very sick with that, would not wish that on anyone. But shingles itself can be quite debilitating with chronic pain, neuropathy, and this can last for years. And you can also get infections in your eyes, which can cause blindness, and you can get very, very sick from this.
If you had chicken pox as a child, do you still need to get the vaccine?
For chicken pox, no, but you need to get the shingles vaccine.
That's what I'm saying. No, the shingles vaccine.
Oh, yeah. That's.
So it doesn't matter whether you had it as a child or not. Play it safe and get the shingles
actually,
vaccine.
you never get rid of it because it lives in your neurons, and it reactivates when your immunity drops, and that's what the shingle vaccine is for. It's better not to get it in the first place, and that's why the chicken pox vaccine is one that you really need to get.
We're going to take a break. 253-5959, touch star 590 from AT&T. Toll free, 1-877-777-0590. Email Jack Pattie at WVLKAM.com, and you can also text us on our Scheller Automotive text line 253-5959. And we're learning as much as we can about these vaccines because they're very important, and we've got some serious and potentially very serious infections that are spreading around our state and across the nation. So that's why we're going to keep talking about this. Back with Dr. Kevin Kavanagh, we're talking about these vaccines. And in case you didn't know, we are the number one state for hepatitis A outbreak, and that's just unacceptable as far as I'm concerned. And sure, the doctor feels the same way. I got a couple of texts here. You got something before we go?
No.
Okay.
We're
all right,
fine.
let's go to our text line, and it's Scheller Automotive text line 253-5959. Jan says, what are hives, and are they the same as shingles?
Absolutely not. Hives are an allergic reaction that causes little blebbing and itching, and you commonly get that from allergies. Shingles is a viral reaction where the virus starts to bubble out of the skin. They can be quite painful because the virus lives in the nerves, and you also get a neuropathy. And a lot of times that pain does not go away. And so that's something that definitely should be avoided.
And that's not related to gout at all, is it?
No, that's not related to gout. And unfortunately, I've got personal experiences with that. Gout's due to too much uric acid in your system. And believe me, it's not fun to have. Uric acid actually is the excretory product from birds. That's what they use.
Oh, really?
Instead of urine, so you can, I guess, say that I'm full of bird
poop, huh?
Poop, and that would be a little bit accurate. But gout's completely different from hives and completely different from shingles.
Okay, here's another question from our text line. Having witnessed what my wife went through with shingles, I'm appalled at what Matt Bevin did to his kids. Now, that leads us to the obvious question, is what he did to his kids, and that is just expose them to chicken pox, a big no-no?
I think that is a huge no-no. That is something you do not want to expose your children to. It puts them through unnecessary misery, but it also sets them up later in life for shingles. So it really doesn't even save them a vaccination. In all likelihood, when the children become educated and more information is on the internet that is positive rather than the scare tactics, false information, that they will get vaccinated, and when that happens, you haven't avoided a vaccination, and you've put them through the chances of becoming quite miserable and also getting severe problems. People do become deathly sick from chickenpox. It's not likely to happen, but why take the chance? I mean, I wouldn't go down and walk the wrong way down an interstate. It's not likely I'd get hit by a car, but it's just a stupid thing to do.
Okay. And you were at the CDC this week, the Center for Disease Control, and
on Thursday, I was attending in the audience in the HICPAC. It's not a big meeting, but it's an important one.
And you were that's when this op-ed that I read a moment ago came out.
Yes, and a little bit kind of put me on edge, obviously, but I was still treated very well, very cordially, and we've had nothing but good feedback from that op-ed. It was listed high up on the daily news release from Kaiser Healthcare News. In fact, the title of the news release referenced the op-ed, and I've also heard back from some individuals and members of the Presidential Advisory Council on Antibiotic-Resistant Organisms that were also complimentary of the op-ed. It is a problem. There's a lot of politics, industrial influence, you name it, that goes into inhibiting the release of numbers and trying to mobilize forces to come against this epidemic.
So you said that you were kind of looked at sideways by the people who were demonstrating, the anti-vaxxers outside.
Yeah, that wasn't real pleasant. I had an involuntary eye rolling. I didn't say anything, but I had one that then got a little upset at that. But
were there a lot of people?
No, there weren't as many as what they were before. There were one or two, but they were a lot bigger than me. And when you've got severe arthritis and can't run very fast, they make you a little nervous. Yeah.
Yeah, but at one point there were a lot of them. Take it.
Well, not today, but several months ago when I was there were a lot of them, and it was quite disturbing. I mean, they're demonstrating against the measles vaccine, which was one of the vaccines they were demonstrating against. They're not vaccinated for measles. They're demonstrating outside a facility which studies measles and obviously has an active virus. That would be the last place I'd be hanging around if I was them. And they're certainly not going to convince anybody from the CDC that vaccines are bad.
Well, the misinformation is, as you said very succinctly, is the problem, and the misinformation is being spread on the internet.
Well, yeah, and they're spreading fear. And it's not a good situation, and this applies to many different topics, but certainly vaccines are one of the areas that misinformation is being spread. There are some reports that the Russians are behind this, trying to create great upheaval in our society, and I've heard that. Of course, that could be misinformation, too. It's hard to know what to believe and what not to believe, but certainly if you're into the news media and on what's been going on with Russia and their involvement in our society, that's certainly not something to be discounted. I would be very concerned about that.
The first thing that I heard years ago was the claim that the vaccines caused autism, which has later been proven over and over and over again to be false. And even the guy who said that has agreed that it doesn't. But once that barn door is open, how do you get the animals back in the barn? Well,
it's hard to do because it keeps getting quoted and requoted, stated and restated, and that's one of the problems you have with bad research is that it's hard to stop. And some of the research that you see that will lead people astray, they will be a lot of spinning in the abstract. That's the only thing that half the people read or 90% of the people read, and that's what takes hold rather than the true data in the paper. With the vaccines and autism, the Lancet has withdrawn the paper. The co-authors have all stepped away from it. And so I think that it is important that people not get scared of that. And certainly if you are scared of things such as autism, you need to also be scared of these infectious diseases. And that's the real problem that we're seeing and what the vaccines are designed to prevent.
I want to move away just for a few moments from this vaccine conversation that we're having. We can certainly go back to it any moment, but Senator McConnell has introduced a bill to raise the nationwide minimum age to buy tobacco products to 21. He originally was going to exempt military in that because the argument would be I can go die for my country, but I can't buy a pack of smokes. But he said after talking to people, I guess, in the medical profession, he was convinced that there shouldn't be any exceptions. How do you feel about that?
Definitely. And one of the things that people have to remember is that if you smoke, it makes you more likely to die for your country because
good point.
You have decrease in wound healing. One of our videos that we used to have up on an anti-smoking website was from the military, and they did a lot of studies on this, and it puts people more at risk for fungal infections of your feet, for non-healing of wounds, for infections, etc. And so it's really a profession that you want to avoid smoking. So it's actually more than contraindicated in the military. It's not just a sort of a rights or coming of age type of an issue, but it is a profession that you need to avoid smoking.
Let's go to the calls. This is Rebecca. Good morning, Rebecca.
Good morning, Jack. I have a comment about the Hep A, and I didn't hear the introduction. Is Dr. Kavanagh with the Board of Health, or is he a practicing physician? Or does it matter?
I'll let you tell her.
Oh, I'm a licensed physician in Kentucky that's a patient advocate and have done a lot of advocacy regarding infectious disease, including publications in peer-reviewed journals, et cetera, over the past 10 years.
Yeah, it scares me that they're not doing they're not vaccinating for smallpox anymore. I mean, I think you would continue on because these things, they're somewhere in the world, and with everybody coming in like they do and everything, and air transportation. But my point is on the Hep A. I walk at Fayette Mall. I go into restaurants and I pick up sandwiches and that and bring home. And I've watched the people. I've been in food service and done the tests and everything over the years. But I watch people with their gloves. They will run the register. They will turn around and put food in a bag, or they'll wrap food. At Fayette Mall, I sat one day eating an ice cream cone, and I was watching this boy at this one restaurant. He did everything with his gloves on. He ran the register. He brought out ice. He did this. Gloves are never changed. And I was going to call the Board of Health and tell them, you need to step up and have these owners make sure that they tell them you've got to change the gloves before you handle any money or go through doors. I've even seen them come across the mall from the different places with their aprons on going to the restroom. So needless to say, I don't much, eat at the mall and everything, but this is one of the problems is it's the food handling. Whether they wash their hands or not, when they got the gloves on, they're taking dirty money from people and putting it in the cash register, and then they turn around and handle your food. So I'll hang up and listen to you.
Okay.
This is a good program.
Good.
Thank you.
Thank you, Rebecca.
Yeah, there certainly needs to be a lot of improvement there. And, of course, when you look at fast food restaurants, those are low-paying jobs. They have a high turnover in people. And I will admit this, I am a fast food restaurant junkie. I do try to eat the healthy options, but I guess that would be in quotation marks at a fast food restaurant.
At least you're honest.
Yeah, but I'm very careful. I also got vaccinated by hepatitis for hepatitis A.
Right.
But you're right. I mean, they have to be more careful. You want to process your food, in a very hygienic manner. This includes vegetables, which we talked about E. coli. Plants are grown out in fields that are fertilized with cow manure. If they're not washed real well and not taken care of, you're going to have an E. coli outbreak. And so that's a problem. You've got a problem with hand washing and just overall hygiene. And, of course, you've got a problem of we're paying people minimum wage, which isn't good for society, and it's fostering, I think, a lot of these epidemics.
I think hand washing by customers is probably a bad thing, too, because I don't think most male customers do wash their hands or don't do that appropriately. I think women are better at it than men, at least the research that I've read on the subject. But I think that's another problem.
Well, and that's true. I wish that most restaurants, especially fast food restaurants, had a hand sanitizer station. And I also wish they had a table wipe that you could wipe off your own table. Now, I know the employees are supposed to wipe off the table, but in my experience, that rarely happens.
Or they're wiping it off with a dirty washcloth.
And I'd be more than happy to wipe it off myself and have a clean table and sit down there and eat, but that doesn't happen either. A lot of people, when they bring their kids to the fast food restaurants, have these little plastic kind of tablecloths. They're little, but they go in front of their child that they put down, and the child can then eat the meals. But, on a child, if you bring them into a fast food restaurant, they eat half the food on the plate and half the food from the table that's fallen from the plate on the table, and they're not the most sanitary little things.
Right.
But certainly you want to promote good sanitation and try not to have a restaurant that is not following health department regulations and rules.
Let's go back to smoking here for a minute. Do you have an opinion on vaping?
That's not good. You're still taking in compound nicotine, which is highly addictive. It has significant heart effects and heart problems. And the overall idea of vaping originally was that this will be a product to get people off of smoking. Now it's becoming a product being marketed to young kids that gets them hooked on nicotine and is probably a gateway to smoking. So vaping is not a good thing either.
That's a good point. I haven't heard it referred to as a gateway to smoking, cigarettes, but that would be logical.
Well, it is. And similarly, I'm also concerned about this big push on making marijuana legal. There's not a lot of good research on the safety of marijuana smoking, but certainly the method of smoking where you inhale the marijuana smoke and then hold it in your lungs for a while before exhaling is a setup for bad things to happen. In general, anything that you put in your body that you don't need to probably isn't a good thing.
Yeah.
And I'm concerned about that. There's not a lot of research, and we may be just trading, one devil for another. We'll have to see in the future. Now, that's besides the uses of marijuana for medical, for getting off of opioids, et cetera, that have certainly more promise. I'm talking about recreational smoking.
Right.
Yeah.
All right, we're going to take another break. No, let's see. I think we've got a call. Let's take the call before we take our break. This is Mary. Good morning, Mary.
Good morning. A couple of quick things. A shout-out for Chick-fil-A. When they clean the tables, they pull out a totally separate, sanitary thing and wipe the table and throw it away and do a next one in the same way.
Good.
They don't use the same old thing over and over again.
Yeah, I like Chick-fil-A. They also have the little sheets for the children that you can put down on the table. I've seen those, and those are free. So, yeah, they're very and they do clean the tables. I mean, they're probably one of the restaurants that clean it the most often.
Now, talking about the chicken pox vaccination.
And that has nothing to do with Chick-fil-A, by the way.
True. The chicken pox vaccination, if somebody gets that, okay, a child or whatever, does that mean that they're not going to get shingles?
Well, right now that is the theory, but let's face it, 50 years down the line, you don't really know how long that immunity is going to last. So there may need to be another booster. Another booster to prevent you from getting chickenpox. But you will not get shingles unless you get chickenpox. Your first exposure to the virus will express itself as chickenpox.
Now, the shingles vaccination, I heard first wasn't very effective, and then they had a new one. What's the story on that now?
That's correct. If you did have the first one, you should get the new one. And I got the new one, and 6 months from now, I've got to get another one.
Do they almost all the vaccines have boosters? Mostly or no?
In my experience, yeah. Okay. And I don't know whether the second vaccination is actually called a booster or not, but I've called it a booster. I think most people do on the street. And most of them you do have to have another one. And, of course, the immunity can wane. Now, that's not a reason not to get the vaccination. That would be a reason maybe a decade or so to get another one.
But it is effective.
Yes. I know when there was a polio outbreak in Iowa that I saw, and I was in La Crosse, Wisconsin at the time when I was in residency, we all took another polio booster because it scared the heck out of us. That was an interesting outbreak. I tried researching it, and I can't find the information anymore on it, but there was a small outbreak.
Do we give polio vaccinations now?
I believe so, yeah.
Routinely?
It's still active.
Okay.
Because there's 3 different polio viruses. And in that outbreak, it was in the Amish community, and they were having a problem with heart disease. And in the Amish community, they didn't take polio vaccines or any vaccines. But if you're a young child and you get the virus, when you're first born, it tends to vaccinate you naturally. But what happened is, in trying to solve the heart disease problem, they introduced some of the Amish in Iowa to those in Pennsylvania who had a different strain of polio in their community, and then they had a polio outbreak.
Mercy.
And I remember, I think I saw the first patient in the ER as a resident in La Crosse, Wisconsin, and it was scary. I mean, we saw really healthy young individuals just become cripples. And I'll never forget that, and that's one of the reasons why I'm so pro-vaccine. I think that you should go out and get those, definitely.
Thanks, Mary.
Thank you.
And we are back with Dr. Kevin Kavanagh. You have written op-ed pieces and articles for magazines and newspapers literally all over the country. I don't know, have you been published abroad too?
Well, some of the research articles we have been.
And you call a spade a spade. You don't. Your writing style is really good, but you also say what you think. And does that cause you problems?
Well, it does sometimes. I mean, you're obviously not very popular, but if you read the book, The Pandemic Century, and I really like this book, that's kind of the way it goes for public health officials and people who call attention to diseases, because there is a huge inertia. People don't want to spend the money to confront them. They don't want to admit that they've got this in their society. And oftentimes the whistleblower is the bad guy, and people will be retaliated against. And so the messenger is always a tough place to be. But when you stick to your message, and after a while you're proven correct, then all that starts to reverse and things turn around.
Yeah.
And so plugging at a different issue or plugging at an issue for 8 years really helps. And then all of a sudden people say, hey, he's got a message, he's been on target, and then you actually have a stronger and louder voice.
Was your name published with this piece in the LA Times?
Oh, yeah, I was published as the author.
As the author,
yeah.
So did you hear anything back from people?
Well, quite a few. I had a lot of emails. As I said, we've
good
heard
and
back.
Bad?
Just good. Just
really?
Good. Oh,
good.
yeah, there wasn't much in that piece.
Were they mostly
at all.
from inside the state?
There were some inside the state, but mostly nationally.
Is that right?
Yeah. And, of course, people will ask, why did I put it in the LA Times? Well, it's basically my wife thought it was a really good op-ed, and she told me to, and I've, after decades of marriage, learned it's just best to do what your wife says.
You're
it's
a smart
easier.
man. You're a smart
It's
man.
easier that way. And I have
How
to
does it work?
credit her for that.
You send them the piece and then wait to hear from them, or do you even hear from them?
Sometimes you'll hear from them and you get turned down. That's usually the case.
Oh, okay.
Otherwise, you'll get a phone call. This one, I had a phone call in 3.5 hours from the time I sent the email that they wanted to publish it.
Is that
Or
right?
not a phone call, I had an email.
Yeah.
And so it was quite rapid, and then it was online about 2 days later. I mean, they went quite rapid getting it published. And so that was one of the better ones that I've written, and something I hope I can maybe generate again, but who knows. But,
I hope you're going to stay on this vaccine thing.
Well, I'm going to try to, and we're also going to try to stay on the antibiotic-resistant bacteria issues, because there's a lot of issues there.
You got 8 years invested in that, too.
Yes, and I hope it turns out better than the 8 years I invested in Game of Thrones. That was absolutely the worst ending ever. That's why I'm so glad we're talking about something different than what I went through Sunday. I mean, the only good show in the season was the one with the White Walkers, and it was so dark you couldn't see it.
I heard about that one.
So what can I say?
But your head is pretty hard, and you don't take failure sitting down. You're going to be pretty.
Well, you just keep going forward.
This.
I mean, this isn't an issue that you can fail with, because these bugs do not care about religion. They do not care about politics. They don't care about CDC regulations. They're out to win. And if you don't do it right, they're going to come after you and come back stronger. And as the toll on society mounts, you will find that politics will eventually merge with science.
Are vaccines, I took some notes here, are vaccines available for all 3 strains of hepatitis A, B, and C?
I don't believe they're available for C.
Okay.
Though there is a treatment, but it's quite expensive.
Chicken pox, measles, mumps, rubella,
Yes.
all vaccines. Shingles,
Yes.
polio.
Yes.
What else? Did I cover it?
Well, you've got the. I'm blanking.
Yeah, I don't want to put you on the spot here.
There's the big one for the sexually transmitted virus.
Yeah. I know what you're talking about.
Neither of us can remember it. That's a sign of being too old.
That is a
Jack.
sign of being too
I know.
old.
We're
one
fading
too.
away.
Okay.
Yes.
How do folks get in touch with you?
Through the website, healthwatchusa.org would be good, or my email, which is Kavanagh, no U in Kavanagh, there's a big difference there, .ent@gmail.com.
Thanks, Kevin.